A truck driver described this exact movement while he was on the operating table. Heart stopped, eyes closed. And he had never seen a surgeon operate before. In video 1, we looked at Pam Reynolds, the musician who underwent complete cardiac standstill and described her surgery in verified detail. That was one case. But here's the thing about the NDE research. The Pam Reynolds case is not unique. Researchers have documented hundreds of cases where patients, during verified periods of unconsciousness or cardiac arrest, perceived things they could not have perceived. Today we look at 2 more, and they follow the same pattern. Al Sullivan was a Connecticut truck driver, 56 years old, no medical training, no prior hospital experience. In January 1988, he suffered a massive heart attack and was rushed into emergency bypass surgery. During the procedure, his heart stopped, and according to Sullivan, he left his body. He described floating up and watching the operation from the ceiling. He described the layout of the operating room, the number of people present, their positions around the table. And then he described something specific. He described his surgeon, Dr. Anthony LaSala, holding his arms in an unusual way, elbows raised, hands tucked under his armpits, upper arms flapping against his sides. Sullivan compared it to a bird flapping its wings, and he asked later what his surgeon had been doing. Dr. LaSala confirmed it immediately, without hesitation. During surgery, to avoid contaminating his sterile gloves when he needs to point or direct a colleague, he uses his elbows. He extends his elbows and uses his upper arms to gesture. It's a personal surgical habit, developed over years. It is not something you would learn from watching surgery on television. It is not something that would be visible from the operating table. It is only visible from above. He saw it from above. Our third case comes from the Netherlands and from the most important NDE study ever published in peer-reviewed medical literature. In 2001, cardiologist Pim van Lommel published a prospective study of 344 cardiac arrest survivors in The Lancet, one of the world's most prestigious medical journals. Of those patients, 62 reported an NDE. One case in the study became known simply as the dentures man. The patient arrived in full cardiac arrest, cyanotic, blue from oxygen deprivation, unconscious before he reached the hospital. During resuscitation, the attending nurse removed his dentures and placed them in a specific drawer, in a specific crash cart, in the resuscitation room. The patient was revived. He remained in a coma for a week. When he regained consciousness and recovered, he gave the nursing staff a description of his resuscitation. He identified the nurse who had removed his dentures. He described the layout of the resuscitation room, and he told the nurse, specifically, where his teeth were. The drawer on the right side of the crash cart. He was correct. The nurse confirmed it, every detail confirmed, and this case was published in The Lancet, peer-reviewed, scrutinized, and it held 3 cases, 3 cardiac arrests, 3 independent verified accounts of accurate perception during periods of verified unconsciousness, a bone saw described in forensic detail, a surgeon's private habit observed from above, a set of dentures located in a specific drawer, independently confirmed by medical professionals with no motive to lie. This is when the science steps in. Because if this is real, if people are genuinely perceiving things during cardiac arrest, then either our entire model of consciousness is incomplete, or something is happening that we don't yet have a name for. Scientists studying dying patients found something unexpected. In the moments after cardiac arrest, when the brain should be going dark, it surged. More organized activity, not less. More coherent than normal waking consciousness. No one knows what it means. 3 cases confirmed by doctors, science finding things it didn't expect. In the final video, we look at what the data actually says and why the answer may be more unsettling than you think. Learn more about this and other cases on unbedsidemanners.com. Subscribe for the final chapter.